A 12-year-old boy with asthma comes to the physician for a follow-up visit. His mother reports that he often neglects to use his inhaled corticosteroid. He has had two emergency department visits in the last 6 months for wheezing. The patient explains that he often simply forgets to bring his inhaler with him. Vital signs are stable and there is no acute distress. Which of the following is the most appropriate next step? Choice A, discussing routines and strategies for inhaler use. Choice B, referral to a psychiatrist. Choice C, encouraging his parents to help remind him of his treatments. Choice D, switching to oral steroid treatments. Or choice E, switching to IV steroid treatments. I'll wait 5 seconds and answer the question. So, pretty straightforward ethics kind of question here. The patient's main issue is with adherence to his medication. So, obviously, you want to go for conservative treatment there. So, the first thing you really want to do is to start building his habits and routines, especially when we're talking about a younger patient here. He still needs to learn how to responsibly use his medications and when to schedule and all that. So, choice A, discussing routines and strategies for inhaler use, is the correct answer. Not much to say here. So let's just go through some of the wrong answer choices here. Choice B refers to a psychiatrist. I mean, this is obviously wrong. There's just nothing here that indicates that he needs to see a psychiatrist. If anybody was going to pick a wrong answer choice on this question, it'd probably be choice C, encouraging his parents to help remind him of his treatments. This can potentially be something you do in addition to helping the patient develop routines and strategies. But it's important for you to help the patient develop their independence and ability to take their medication on their own. And that applies to patients no matter the age, unless they have a mental impairment of some kind. MBMEs might give you some kind of variation of this kind of answer choice where someone outside of the patient themselves is helping them with it. They might say something like, oh, ask the school staff or ask their parents or ask their friends to help remind them. All of them would probably be wrong answers in a question like this. And choices D and E are wrong because this is just here to test you on your ability to almost apply common sense in a way to say that there's nothing really wrong with the actual medication he's taking. So switching to a stronger medication, in this case, oral or IV steroid treatments, which can be used for asthma in more refractory cases, but it's inappropriate because, like I said, there's nothing wrong with the actual medication. So yeah, not too hard of a question. Sometimes the MBB really likes giving you these kinds of conservative treatment kind of questions, and you need to be able to recognize that. I hope you found this video helpful. I'll see you in the next one.